Using a commode after a hip surgery. Getting up from the commode. Scoot closer to the edge of the commode. Stretch the operated leg forward. Stand up slowly with one hand each placed on the walking frame and armrest. Bring the operated leg back to the center. Sitting down on the commode. Move backwards towards the commode. Stretch the operated leg forward. Place one hand on the walking frame. Reach for the seat as you lower yourself down. Do not bend more than 90 degrees at the operated hip. Scoot yourself backwards. Flushing the toilet. Take a few steps to turn towards the toilet seat. Reach for the flush without bending more than 90 degrees at your affected hip. Why are these positions wrong? The first position is wrong because the person's hips are twisted. The second position is wrong because the body is bent too forward with hip angle less than 90 degrees.